Welcome to Vcodemy medical coding training. So in this video you will learn the guidelines needed to code the chapter 1 infectious and parasitic diseases. So this chapter encompasses all the viruses, bacteria, fungi and all such organisms which cause disease in mankind. So these diseases are found in this chapter 1 in ICD-10-CM. So as you can see in the slide, these are some of the parasites: protozoa, fungi, prokaryote, virus, prion. Some are acellular, some are cellular, which cause all kinds of diseases in humans. So we need to code each disease with a code from this chapter. Okay, the chapter starts with the alphabet A, and you will be using the alphabet B also for the codes, for picking codes from this chapter A and B. So ICD-10-CM codes within this chapter include diseases generally recognized as communicable or transmissible. So what do you mean by transmissible? So it can infect one person who can transmit or share the disease with another person or a community. It can spread from one person to another person very easily. So such infections and diseases are covered in this chapter. The chapter is broken down into these subsections. A00 to A09, this category range has intestinal infectious diseases. A15 to A19, this category range uh, encompasses tuberculosis, also known as TB. A20 to A28, certain zoonotic diseases caused by bacteria, viruses, and parasites spread between animals and humans. Bacterial diseases. These are covered in the range A20 to A28. So, what do you understand by the term zoonotic? Zoonotic means a infection which starts in an animal, that is a different species, and then it jumps into humans. Okay, so the next range is A30 to A49, other bacterial diseases. A50 to A64, infections with a predominantly sexual mode of transmission. A65 to A69 category range has other spirochetal, spiral shaped bacteria diseases. A70 to A74 range has other diseases caused by chlamydia. A75 to A79 rickettsiosis. A80 to A89 has viral and prion, a type of protein that can trigger normal proteins in the brain to fold abnormally. Infections of the central nervous system, CNS. A90 to A99, arthropod bone viral fevers and viral hemorrhagic fevers. B00 to B09 category has viral infections characterized by skin and mucous membrane lesions. B10, other human herpes viruses. B15 to B19, viral hepatitis. B20, this is HIV, human immunodeficiency virus disease, which causes AIDS. B25 to B34 category has other viral diseases. B35 to B49 mycosis, diseases caused by an infection with a fungus. B50 to B64 is protozoal, single-celled heterotrophic eukaryotes diseases. B65 to B83 helminthiasis, parasitic worm infections. B85 to B89 pediculosis, infestation of human head and body louse. Acariasis, rash caused by mites and other infestations. B90 to B94 sequelae, of infectious and parasitic diseases. What do you mean by sequelae? So once the active infection is completed and it is cured in the patient, it leaves behind some side effect. It's called sequelae. B95 to B97, bacterial and viral infectious agents. B99, of course, that is the last category, other infectious diseases. So oftentimes the codes in chapter 1 are mentioned in instructional notes following codes from different chapters. For example, under category J04, you can open your book. If you have your book with you, go to J04 category, acute laryngitis and tracheitis. The instructional note informs coders to use an additional code to identify the infectious agent and refers to the code range B95 to B97. You get the infectious agent from the category B95 to B97. Codes for acute laryngitis and tracheitis do not have an infectious organism as part of the code description, and therefore it is necessary to use an additional code from chapter 1 for the bacteria or virus. Okay, so what I'm trying to explain is I've started off with the chapter specific guideline for chapter 1, infectious and parasitic diseases. As you must be aware as coders that the ICD book contains general coding guidelines and also chapter specific guidelines, and we have currently 23 chapters in ICD. So we are just learning about the guidelines on how to code the chapter 1 diseases. So you have to use an additional code for identifying the bacteria or virus if the main disease code does not include it. So this is especially relevant for codes found in other chapters other than the first chapter. So you have a disease, for example, a very good example is urinary tract infection. It will be found in the chapter in the male genital system. So the disease is pertaining to the male genital system or urology section. So you have the patient having urinary tract infection. So it has to be caused by an organism because it is an infection, right? So it is caused by a bacteria. So for that bacteria, for that infectious agent code, first you will be coding urinary tract infection, which the code for urinary tract infection is N39.0. So under that you have an instructional note. Use additional code to identify the infectious agent causing this infection from the chapter 1. So this guideline is instructing you to go to chapter 1 and get the infectious agent which is causing the UTI. Okay, so what is an infectious agent? The bacteria or virus or fungi, whatever microbes which is causing the disease. So the bacteria causing the UTI is the infectious agent here in our current example. So in addition to N39.0 comma, you have to sequence the additional code, that is the infectious agent code. Hope this is clear for all of you. Coming to the next slide. However, the documentation may not support assigning this additional code since the provider may not know which infectious agent caused the disease or the lab results may be inconclusive. So it is not required to use the additional code. Only apply the code if the documentation supports it. So the documentation, the medical chart, as a coder you will be reading the medical chart. That document should contain this information about the infectious agent. If it is missing, of course you can query the provider. Hold the chart for coding and then query the provider, get extra information about the infectious agent. So otherwise you will not be able to use the additional code. And also the lab results are still pending, inconclusive. So then you have to wait for coding. Okay. And coders should note, however, that there are combination codes within the chapters of the ICD-10-CM manual that include both the organism and the associated condition. So this is another scenario for you. So here, For example, for UTI, you have to pick the infectious agent code. So you have two codes, multiple coding. But sometimes to make your work as a coder easier, ICD-10 actually has combination codes available where the disease condition plus the infectious agent is also present in one single code. They are called combination codes. Example, MRSA, methicillin resistant staphylococcus aureus. So here it is like sepsis due to MRSA. You have a single code for it, J15.212. So patient is diagnosed with an infection due to MRSA reported using combination codes. It includes the causal organism and appropriate condition. So A41.02 sepsis due to MRSA code J15.212. So that combination code. So you are supposed to use the combination code when it is available. Okay. So when you are using a combination code, what rule should you follow? So you should not use the infectious agent code again. That will become redundant. So repeatedly using the codes to give more repeated information, which is called redundant, of no use. Okay, you're not going to code something new. No new information is being provided to the insurance. So for example, E. coli. This is a condition within this chapter with specific coding instructions. For example, code category J15 bacterial pneumonia not elsewhere classified includes combination codes such as J15.5 pneumonia due to Escherichia coli or E. coli. It would not be necessary to use the additional B96.20 Escherichia coli as the cause of disease is classified elsewhere to identify the infectious agent. When you are picking a combination code, that is the disease plus the infectious agent is there in that code, again you don't have to take the infectious agent code again. So please do not use. So that will just add on to the redundant information. Although there is an instructional note following N39.0 urinary tract infection, site not specified to use an additional code to identify the infectious agent. Assigning codes A41.51 sepsis due to Escherichia coli E. coli and N39.0 is adequate. Assigning B96.20 as an additional code would be considered redundant, because the combination code is self-explanatory. Okay. So hope you all understood the concept of combination codes. Moving on to the second guideline in this chapter. So we are moving to HIV. Okay. HIV disease is another condition within this chapter with specific coding instructions. Note that the code for patients who are HIV positive, Z21 asymptomatic HIV status is within the chapter 21. So the default code B20 is used for patients who have symptomatic HIV or HIV disease. Additional diagnosis will likely be assigned for symptomatic HIV patients. So HIV patients, first they go in for a blood test. So which tells them, so you have contracted the disease HIV. So you are positive, your blood test comes back positive for HIV. So now you are a HIV positive patient according to the blood test. But do you have symptoms? That depends. So the patient will say, yes, I have been having severe weight loss for the past 6 months. So that is a symptom of HIV. What happens is the patient comes in to check the uh, blood for the presence of HIV. It is positive, but he does not display any symptoms. No symptoms at all. He is quite healthy. Then it's called asymptomatic HIV. So you should know the difference between symptomatic and asymptomatic HIV. And also the instructional note at B20 states to use additional codes to identify any manifestations, that is any symptoms of HIV. Coding guidelines specifically state that a coder can only report confirmed cases of HIV infection. So you cannot code if the definitive diagnosis of HIV is present in the document. So check if it is confirmed code diagnosis. The provider should say it is confirmed patient has HIV. So that is enough. That is a definitive diagnosis. You can code B20 if it is symptomatic. So this is both in the inpatient and outpatient settings in the hospital. Coding of only confirmed cases is an exception to the inpatient hospital coding guideline about reporting suspected, probable, or possible diagnosis at the time of discharge. So it's very important to note that in this context, confirmation does not require documentation of positive serology or culture for HIV in the lab report. The coder only needs the provider's diagnostic statement that the patient is HIV positive or has an HIV related illness to report the codes. So if there is any doubt, of course, you can query the provider. B20 is for symptomatic HIV. Z21 is for asymptomatic HIV status. So, because you are having a code for HIV, that is B20, comma followed by all the manifestation codes. So, you will have multiple codes, multiple ICD codes. So, then how would you sequence them? Which will be the principal diagnosis? Which will be the first code you will present to the insurance? So, for patients admitted with an HIV related condition, B20 is used for the principal diagnosis followed by the codes for all HIV related conditions. It's called HIV related conditions. Due to the HIV, the patient is having all these manifestations, like for example, opportunistic infections, okay, which do not affect the normal healthy population, but HIV patients can easily get any infection because their immune system is down. Okay, so that is called, those infections are called opportunistic infections. So what is a non-HIV related condition? So any person can have a trauma, accident on the road, any injury, even in his residence. Okay, so all these can happen to anyone, HIV patient or non-HIV patient. So these are called non-HIV related conditions. So for example, if the HIV patient is admitted with pneumocystis pneumonia, the principal diagnosis will be B20, followed by B59 pneumocystosis. If an HIV patient is admitted for a non-HIV related condition, as I told you, like any trauma or accident, road accident for example, he is coming in for that. But he is also HIV positive, but he is coming in for a HIV non-related condition for treatment. Okay, then the non-HIV related condition will be the principal diagnosis, followed by B20 if the patient has HIV. So be very careful with this sequencing. Okay, if it is HIV related condition which requires the treatment, B20 will be the principal code. If it is a non-HIV related condition which requires treatment, then the non-HIV related condition will be the principal diagnosis, comma the second code will be B20 followed by any other manifestations of HIV. Okay, hope this is clear. So the next important guideline in this chapter is regarding sepsis. Okay, so what is sepsis? Another major infection which can occur in one part, in a localized infection in one part of the body, but it can spread throughout the body through blood. Okay, so that is sepsis for you. So many organs will be affected in sepsis. So another major infection listed in this chapter is sepsis. Sepsis is defined as an infection accompanied by an acute inflammatory reaction with systemic manifestation. Systemic means throughout the body, not localized. Systemic means throughout the body. So this is associated with the release of numerous endogenous mediators of inflammation in the bloodstream, basically a system-wide inflammatory response. Sometimes you would have heard the word SIRS, SIRS. Then you have sepsis, severe sepsis, septic shock. So always check the medical chart if the patient has SIRS or sepsis or severe sepsis or septic shock. So you have to code accordingly. Another thing which you have to bear in mind is when you are coding sepsis, you will most likely be using two or more codes. Okay, two or more codes. So the ICD-10-CM code for sepsis is assigned based of the infectious organism if known and is found in the ICD-10-CM categories A40 and A41. So the default code for sepsis or septicemia is A41.9. There are specific guidelines for the sequencing of sepsis codes. If a patient is admitted with sepsis, the underlying systemic infection, the sepsis is sequenced first. Okay, the sequencing is very important. Severe sepsis is sepsis accompanied by signs of failure or dysfunction of at least one organ, like respiratory failure, kidney failure, heart failure. Okay, that is called severe sepsis. So in severe sepsis you should have a organ dysfunction or multiple organ dysfunction. So that is one criteria. Cardiovascular failure is typically manifested by hypotension, respiratory failure by hypoxemia, renal failure by oliguria, and hematologic failure by coagulopathy. Septic shock is said to be characterized by failure of the circulatory system to maintain adequate perfusion of the vital organs. So that is severe sepsis for you. So when you're coding severe sepsis, you will have a first you will be coding the underlying systemic infection. That is the first code, principal diagnosis, followed by the severe sepsis code. Then third code will be the which organ has suffered the dysfunction. Like for example, here the patient has kidney failure because of sepsis. That will be the third code. Okay. If a patient has sepsis and associated acute organ dysfunction, coders need to follow the instructions for coding severe sepsis found in chapter 18. So it is important that any acute organ dysfunction be linked to the sepsis. So due to the sepsis, this organ dysfunction has occurred. That should be specifically documented in the medical chart. If the organ dysfunction is not due to sepsis, you cannot take the combination code. So it is important that any acute organ dysfunction be linked to the sepsis. For example, do not assume that a patient with acute kidney failure and sepsis means that the sepsis caused the acute kidney failure and the patient now has severe sepsis. It must be clear that the organ dysfunction is related to the sepsis diagnosis. If not, query the provider for clarification. A patient may have end stage renal disease due to diabetes, with the diabetes as the cause of kidney failure, not sepsis. If that is mentioned in the document, you cannot take the combination code. Note that negative or inconclusive blood cultures do not preclude a diagnosis of septicemia or sepsis in patients with clinical indicators of sepsis. So the patient may have been given antibiotics or there may be technical issues with the blood sampling. In these cases, the coder should query the physician for clarification. Sepsis is usually associated with bacterial infections. However, viral infections can also be the cause. The codes to be used for viral sepsis are A41.89, other specified sepsis, and B97.89, other viral agents as the cause of diseases classified elsewhere. Hope this is clear for you. So, we have touched upon on all the major guidelines in this chapter. Chapter 1, Infectious and Parasitic Diseases. So, in conclusion, Chapter 1 in the ICD-10-CM manual has thousands of codes identifying a wide range of infectious and parasitic diseases. Pay careful attention to coding guidelines and instructional notes throughout the entire manual to identify the use of these codes and sequencing guidance. So do get in touch with us for elaborate explanations with examples. Contact us on WhatsApp or call 9944478988 Vcodemy Medical Coding Training Center. Hoping this video provided you with excellent educational content. Thank you.